Hello again. We are now in the Cancer Prevention Seminar number 13. And now we are going to focus on other types of cancers that we didn't talk before. Remember, we had so far an introduction of the causes of cancer, definition of cancer. Then we went to different cancers that are more common in the country and in the world, and those that are a higher risk for populations. Then I compile now the other cancers in two chapters, chapter 13 and 14, and we will start with chapter 13 now, covering those other types of cancers. So we have here just a summary of what we have dealt before. We cover prostate, lung, and colon cancer that are common for men and women, and we cover also breast cancer for women, and then now we go to the other ones that are not that common, like the bladder, the skin cancer, the endometrium cancer. Now let's talk about ovary cancer. Ovary cancer is the 7th most common cancer in women, is the 7th most common cause of cancer deaths for women in the world, and is more prevalent in the United States and Europe, about 8 to 100,000 people, and in Africa and other countries is in Africa and Asia is 5 for 100,000. In Brazil is 5.2 per 100,000, and is 4.1 per 100,000 in China, kind of half of the prevalence than in the United States and Europe. So it's a cancer for more developed countries. Why? Let's talk about that. Is high in other parts of the world. In some countries, like in the Philippines and Singapore, has a high incidence. In the United States, is higher among whites, is higher among Jewish of Ashkenazi descendant, and 90% of these cancers are carcinomas, and they are more frequent after menopause. Only 10 to 15% occur before menopause. And this cancer is related to breast cancer because the same markers for breast cancer, like the BRCA1 and BRCA2, are frequent in 5 to 10% of the case. So it's important to check the family history for this cancer, because there is a higher risk if you have, or if a woman have the siblings or ancestors with this positivity or history of both breast cancer and ovary cancer. Breastfeeding is protection. Breastfeeding offers protection to ovary cancer. And it looks like the contraceptives are built. Breastfeeding is protective against ovary cancer, and the contraceptives or birth control pills also offer protection. But don't forget that contraceptives increase the risk of embolism and increase the risk of breast cancer. So you have to balance those things and know those things. And hormone replacement therapy is a cause of ovary cancer. So any replacement of estrogen will increase the risk of ovary and other types of cancers. Other factors that are related is adult attained height for women. we are talking about a cancer that is only for women. But don't forget, when we say that a woman that is too tall might have a higher risk, is mostly not because the size of the person itself, but what happened during childhood and sometimes what happened during the pregnancy, that factors that the woman, the mother was lifestyle of the mother, so what was the mother doing, and then what they did for the children in terms of food, and mostly high energy foods. The female hormone is a cause, and then all the things that occur because of the estrogen influence, similar to breast cancer, are also related to ovary cancer, like no procreation, having an early menarche, a first menstruation very soon in life, and then a late menopause, menopause that starts late in life. Being obese is a cause of this cancer too, and mostly related to a higher BMI. Waist and hip ratio and waist circumference were not consistently related to this cancer. So mostly BMI, if the BMI is over 30, that this is is considered the level for obesity. So is the higher, that's the show the higher rates of this cancer for women, mostly after the menopause. Sex steroids or hormones, estrogen, androgen, and progesterone are related to obesity and cancer. The adipose tissue, and this is very important, is the main sign of production of estrogen in postmenopausal women. So it's not anymore the ovary that is producing these hormones, because they are producing the ovary, but now they become being produced more in the abdominal part and in general in the adipose tissue. Increased activity of the aromatase enzyme in the subcutaneous fat is the mechanism, because aromatase increases the conversion to androgen or of androgen to estrogen, that is the hormone involving this cancer. Also, obesity can cause inflammation, and then once some substances like the tumor necrosis factor alpha or the interleukin 6 or leptin are produced in more quantity once a person is obese, and those factors create inflammation and are considered cancer promoters. So, in general, a tall white woman that has more than 50 years old has a family history of breast cancer or ovary cancer. No, she does not have children. She starts her menstruation very early in life, and then she finishes the menopause very late in life. She is of Jewish descent, and then and she took hormone replacement therapy. So this is all the symptoms or the signs that this person must have to be screened for this type of cancer. Now let's move to bladder cancer. Bladder is where we deposit our urine that is excreted from the body. It's interesting that this organ is mostly at the end of our body, and the function of bladder cancer is just to excrete urine. And one of the things that we know is that something that comes to our air might affect some polluting activities might affect this cancer. We will see this later. More than 400,000 cases, new cases in 2012 is the 9th most common cancer in the world, is 4 times more frequent in men, and usually in older men with a diagnosis made around 73 years old in the United States. And 60% of these cancers happen in the United States and Europe or high-income countries. The 5-year survival for this cancer is 76%. So not bad, and probably because of the early diagnosis, and it looks like this cancer is not one of the very aggressive cancers. This cancer in other countries, not in the developed countries, are related to infection with the schistosoma hematobium or schistosoma hematobium, depends on when you're coming from. And this is more like in the developing countries in Asia and other countries. As I mentioned before, industrial pollution like naphthylamine, polyaromatic carbons, from people that work in places like that might increase the risk of this cancer. This cancer is high in workers that work with sheet metal, workers that work with machine operation, and then plastic and chemical industry workers also are affected by that. That's important that these workers have a very high level of protective masks in order to filter those substances and hydrocarbons and naphthylamine in order to prevent this cancer. And smoking is also a factor. Smokers have 6 times higher risk of this cancer. And that's what I was talking in the beginning. You inhale something here, it goes to your lungs and then goes to your blood and then ended up going to the kidney that filter it and go to, and finally it goes to the bladder. And this substance will affect the mucosa of the bladder and cause cancer there very far away when you start using the substance here in your mouth. Just to show you how dangerous is smoking for your health, because you think that smoking will just cause something locally or at least in the lungs. No, it contains so many substances that are cancer agents that this will spread around the body. In developing countries, and sometimes in developed countries, arsenic in the water has a relationship with this cancer. Arsenic can come from natural sources or for water contamination from chemicals in factories. The countries of concern about arsenic are Bangladesh, India, Cambodia, Argentina, Chile, and Mexico. There is a limited evidence that a high consumption of fruits and vegetables protect against this cancer. And also there is some evidence that tea consumption decrease the risk of this cancer. Tea, as black tea, it has a lot of antioxidants, as we know. One study that I found, Michaud et al., they compare people with bladder cancer with the amount of water that they take. or that they drank. And so those that drink 6 cups of water per day compared to those that eat just 1 cup of water per day. And the risk of bladder cancer decreased 7% for each increment of 1 cup of water, or 250 mLs, or 8 ounces. All liquids decrease 50% the risk of cancer for those drinking 2 liters per day compared to those that drink 1 or less liters per day. In the Advanced Health Study, we only had, in the Advanced Health Study 1, 46 cases of bladder cancer. And then we figured out there that beef, consumption of red meat, increased the risk of the cancer twice as much compared to those that don't eat beef. So we are waiting now for the Adventist Health Study number 2 to see what are the relationship, or if this relationship stands. And maybe in the Adventist Health Study number 2, we will have more cases of bladder cancer, as we have 96,000 participants in that study. Now we change again to another type of cancer, endometrial. Endometrial cancer, or uterus cancer, is the 6th more common cancer in women. The incidence is 290,000 in 2008. Is a cancer of the high-income countries, 15 per 100,000 in Europe and the United States, and only 5 per 100,000 in Asia and Africa. The 5-year survival is 69%. What are the factors related? Contraceptives, or taking birth control pills, will protect against this cancer. Estrogen, on the other side, is a cause of the cancer. Exercise protects against this cancer. Coffee also protects against this cancer. Overweight is a cause of the cancer, and the glycemic load probably increases the risk. Is a cancer related to the estrogen, or the female hormone. Let's talk about the glycemic load. It probably increases the risk. 18% increased risk for every 100 grams extra of carbohydrates intake. The glycemic index also produces hyperinsulinemia. That is a factor to increase insulin growth factor 1. Glycemic load is very common in high-income countries. And then sugars and high-processed foods are the most common foods that have a high glycemic load and a high glycemic index. When we talk about glycemic index, is when you eat some foods, you have in 1 hour a peak of sugar in your blood. Those are high glycemic foods. Mostly, the most common high glycemic foods are sugar and white rice and white grains. Also, when a person has excess of insulin, it produces more insulin growth hormone. Insulin growth hormone, it produces cell growth, reduces cell death, and it stimulates cell division. So also insulin and IGF, they block the sex hormone binding globulin synthesis, the SHBG, that occupy estrogen receptors. This is something interesting. The SHBG, it looks like is increased in people that eat more fruits and vegetables. And the function of SHBG is to occupy in the ovary, in the breasts, and in the uterus, the receptors for estrogen. So when estrogen that's circulating goes to those organs, it does not stay there because there is this SHBG that is blocking its effects or its attachment to the organ, and then it will not have the effect of estrogen to increase or stimulate cell growth in these organs. Regarding the uterus cancer, abdominal fat is a cause. So not only having obesity or having excess of fat, but if a woman has fat in excess in the abdominal, then this fat will increase the risk of this cancer. The fact of a person, the same happens here related to ovary and breast cancer. The estrogen effect. So a woman that has no bearing children, early menarche, late menopause, and then these are factors that will increase the presence of estrogen in the body. And there is another cause here is a drug that is used for breast cancer after breast cancer chemotherapy and surgery. Tamoxifen is used to prevent recurrence of that cancer. So it's very important for women to know that tamoxifen will prevent that for sure, but will increase the risk of endometrial cancer, what is not a good idea. What are other factors for endometrial cancer? History of hormone replacement therapy during menopause, so the fact that a person is using HRT. Infertility or inability to have children, we already mentioned about that. Obesity. And then we have diabetes, hypertension, and the use of tamoxifen, as we mentioned before. There is a connection between endometrial and colorectal cancer. So a woman that has a family of history of colorectal cancer that is not polyp might have a high risk of endometrial cancer. We don't know very well why, but it might be related to some genetic influence here. 1/3 of the cases of the endometrial cancer is related to obesity. Obese women have 4 times an increased risk. Today we know that once a person is obese, he has high level of estrogens and have a high level of insulin. Both of them are cancer promoters, and specifically estrogen is an endometrial cancer promoter. So remember that I mentioned that for women in the menopause or postmenopause age, she will, if she is obese, she will produce estrogen from the subcutaneous tissue. Now let's go by cervical cancer. Cervical cancer is known in the United States with this name. If you go to the British countries, they call cervical cancer, so it's weird. But as you see, in the United States, in California, is more common among Hispanics than other race. And this cancer is more common also in developing countries. Now, it is not a cancer of the high level or high developed countries because it's related to somehow infection. Cervical cancer is considered sexual transmitted disease. there will be a need of intercourse for the cancer to be propagated or developed. Is related to sex intercourse before 18 years old. Is related to sexual promiscuity, multiple partners, or husband that have multiple partners. The cancer itself is related to the HPV virus, human papilloma virus. There is some suspicion that the herpes virus also is related. But HPV is the basic one that for sure we know about. And then smoking also is related to the cancer. And then you might say, well, is related to virus or is smoking? And probably is smoking open the way, is a promoter of, for the virus to install in the cervix of the uterus. There is some evidence that vitamin A deficiency might be a factor. Vitamin A deficiency helps, or vitamin A deficiency happens mostly when people don't eat fruits and vegetables that are yellow or dark, like carrots and beets and tomatoes and pumpkins and those similar ones. And also dark green leaves. Cervical cancer is the second more frequent cancer in women in the world, mostly because of the developing countries. It's common in young ages, and the survival is in 5 years is 50%. And mostly because the diagnosis in those countries is not made that easy or that earlier. So cervix is the lower part of the uterus, and that's where this cancer is located, and that is why this cancer is considered sexual transmitted, because is close to the sexual organs. The human papilloma virus infections are also related to cancers in other parts. First in the sexual organs, the vulva and vagina in women, and also in the penis for men. But is also related to cancer anal cancer, mostly for homosexuals, and then in throat cancer, in throat and sometimes esophagus cancer, mostly because of oral cancer, and more frequent among homosexuals also. And then the HPV infections also can cause genital warts. It's considered, as I mentioned, a sexual transmitted disease, and then normally screened like normally screenings for this cancer, like the pap smears, can find the cancer cells. They call the Papa Nicolau smear. Gardasil is a vaccine for more cancer-related types of HPV, number 6, 11, 16, and 18. Cervarix is another name that they have in different countries. The HPV 16 and 18 is 70% of cervical cancer, and the HPV 6 and 11 is responsible for 90% of genital warts. And the HPV 16 also relates to oropharyngeal carcinoma, the throat cancer. So those vaccines are approved in men, mostly for homosexuals, to prevent genital warts, anal cancer, and probably penile cancer, mostly for homosexuals. And this vaccine is given also to women, young women, mostly because of the risk of this disease. is a very controversial issue because some people do not like to give this to their children. But if children are sexual active, they should, at least the women, should take this vaccine. Gardasil is produced with virus-like particles that resemble the HPV variant, and then the body will produce an antibody against these viral-like particles and against HPV. And then when you take this immune vaccine, it will kill the HPV or develop the body. It's a vaccine, develop immunity against this virus. Is 3 injections in the 3 months period, and there is no much effect of this vaccine or a reaction. It mostly is right after you have the vaccine, painful shot, local soreness, nausea, fever, fainting. Maybe the fainting is more like a reaction, a psychological reaction. But there is no other serious effects against this vaccine as we know. Women who used Women who have used diethylbestrol during pregnancy could have their doctors with increased risk of this cancer. But this is a drug that is not used anymore. But if a person know that in the past they have used that, they have an increased risk of this cancer. The absolute prevention of cervical cancer is sexual abstinence, or sex with a married relationship with mutual fidelity. And if a person has sex with others, and then at least they should protect, the sex should be protected, or use the vaccine. Again, we promote, as we are from a Christian university with a Christian perspective, we promote sexual abstinence and sex within the relationship. What happens sometimes is that a person has sexual relations before the marriage, and then they can pass this after because it's a virus. It can pass. So it's important then that they have a proper treatment or a proper access to this and screen for these, mostly for this virus. That's the message here from the Center for Disease Control in the United States. So I'm going to read that. Sexually active adults can also lower the risk of HPV by being in a mutual, faithful relationship with someone who has had no or few sex partners, or by limiting their number of sex partners. The fewer partners a person has had, the less likely he or she is to have HPV. But even persons with only one lifetime sex partner can get HPV if their partner has had previous partners. So exactly what I mentioned before. Now let's talk about skin cancer. Sun is a good thing for us, but too much sun might have a problem. It is considered the most common cancer in the world. People more affected are those with white skin, and the cause is sunlight exposure. The protection, again, very easy. Use a hat, use sunblock. Avoid staying too long in the sun, and avoid sunburns. So definitely, the idea to stay hours and hours in the beach to have a tanned skin is not a good one. going to tan parlors also is not a good idea, because the UVB, or ultraviolet B rays, and the UVA, ultraviolet A rays, are for sure cancer agents, and then it's not a good idea to be exposed too much to those rays. 90% of the cancers are non-melanomas. 1 to 100,000 in Africa and Asia, but 30 to 100,000 in Australia and New Zealand. Maybe the sun is, they are more exposed to the sun there, mostly the whites, and 15 to 100,000 in the United States. The ultraviolet B radiation can affect the p53 suppressor gene. Remember, I mentioned that there are some genes that are, we talked in the first session, that are suppressor genes. They go to the cell and protect the cell. If the cell starts getting cancer, the gene will go and trigger apoptosis, and this cell will die. But when you don't have this gene working because of UVB radiation, you have a high risk of, at least in the cancer of the skin. Here we have what the p53 gene does. It triggers cell suicide. There is a normal cell, and then there is a cell, the second cell is a cell with excessive DNA damage. And then you see in the small spots, red spots, that the p53 protein is all there. And then they will go there and destroy or cause this cell to kill itself, that we call apoptosis. Melanoma itself is the worst type of skin cancer. It's very aggressive and is related to one episode of severe sunburn. So if you stay in the sun, please avoid to get this sunburn. This sunburn of the weekend that people go to the beach and then in the office next day they are completely reddish. So that's not good. Immune suppression in organ transplants also can cause melanoma, and the presence of AIDS or having AIDS will increase the risk of melanoma. Besides that, AIDS will increase the risk of Kaposi's sarcoma. Long-term exposure to arsenic through the drinking water also can cause skin cancer, and we mentioned about bladder and kidney cancer and also lung cancer. The secure level in the water should be 0.01 milligrams per liter. And then, as we mentioned, the source for that could be agricultural or mining, that would be artificial or contamination, or volcanic activity that is more of a natural source of arsenic. Now we have a video. Let's go to this video to illustrate a little bit our topic so far.
How to check yourself for skin cancer. Most dermatologists recommend examining your skin once a month to become familiar with what it looks like normally, so you'll be able to recognize something that's abnormal. And since skin cancer is curable if caught in an early stage, your life just might depend on it. You will need a full-length mirror, a handheld mirror, good lighting, optional, a camera, a blow dryer. Step 1. Familiarize yourself with the ABCDs, that is, asymmetry, border, color, and diameter. Moles or birthmarks that are asymmetrical, have a jagged or irregular border, are blotchy or not all one color, or are bigger than about the size of a pencil eraser should be seen by a doctor. Step 2. Check yourself immediately after bathing so you're clean. It's important to check your entire body. Step 3. Examine your hands, including your palms and fingernails. Step 4. Use the full-length mirror to inspect your arms, elbows, and underarms. Take pictures of moles or birthmarks so that you'll have something to reference if someday you're unsure whether the mark has changed in appearance. Step 5. Check your face, neck, and head in the full-length mirror and use a handheld mirror to see the backside. When checking your scalp, it is helpful to have a blow dryer on hand to make parting your hair a bit easier. Step 6. Check your chest and back and beneath your breasts. Men should pay special attention to the trunk and women to their legs. These are the most common areas for them to develop melanomas, the most dangerous form of skin cancer. Step 7. Turn your back to the full-length mirror and use the handheld mirror to inspect the backs of your legs and buttocks. Use the hand mirror to inspect your genital region. Step 8. Sit down to inspect your legs and feet more closely. Step 9. If anything seems to fit the ABCD rule, if anything is new or has changed since your last check, if you have a sore that won't heal, or if you're uncertain about anything you find, see a doctor. Did you know? Every year in the US, over 1.3 million people are diagnosed with skin cancer, making it the most common form of cancer.
As you saw in the video, there is some characteristic of cancer in the skin that you should be aware. As we mentioned about melanoma, it's important to know that the men have more risk of melanoma in the trunk and women in the legs. So just to be sure that you check yourself for that. But they have the ABCDE techniques or description of a mole, that is those black spots that you have in your skin. So A is asymmetrical. So half of the mole does not match the other. So you have one part round and another part rough, so or irregular. So that's not good. Border. Many times a cancer will not have a regular round mole, but will be irregular, ragged, or with the blurred edges. Color. When you have several colors in the same mole, like tan, brown, black, and other colors, that's not good. So if it's just one color, the prognosis is that it might not be cancer. The diameter also is important. So if it's larger than 1/4 of an inch or growing, I would say is not even the size, but you check the size today and then in a few months it's growing, so that's a matter of concern. And the same thing with E, evolving, changing size, changing appearance, changing color, any changes that can occur, even bleeding, itching, or hurting that start in a mole, you should check. Here is an example of some of the things that we mentioned. Different colors in the bottom right. In the upper right you see irregular and kind of not matching, and then in the left side you see one that is yellow, white, and reddish. So this is also something that it should be checking. One more characteristic is that if there is a peeling or every time there is a skin that creates a crust, and this crust is peeling all the time. So this is a matter of concern, and you should check with the dermatologist for that. Regarding the sunscreens or sunblocks, we advise the SPH 30 or more. SPH stands for sun protecting factor, and usually if it's 30, it is okay to protect the skin. It should be broad spectrum. If you can find this written in the bottle of the sunscreen, because it protects against both UVB and UVA rays. Should be water resistance, the best if it is water resistance, because they will specify how long it lasts after you go to the water. It should be photostable, that will not break down when we have a strong UV rays exposure. Usually they have the helioplex or pure screen that are factors, that are substances that are found in those sunscreens with SPF of 30 or more. And then finally, the tips for you to use sunscreens. Make sunscreen part of your routine. So if you go outside anytime, you put sunscreens. It should be higher than 30 when outdoors. Reapply them often after swimming, perspiring, or using a towel. When you are in the beach, you should use as much as possible sunscreen. When I was a kid, my mother used to apply one time, and then we stayed the whole afternoon in the beach, and that's not the good way. It's better to apply constantly. If your skin is sensitive and you should use the mineral source filters or sunscreens like titanium dioxide or zinc oxide. And again, it's important for people that have very whitish skin. God made two great lights, the greater light to govern the day and the lesser light to govern the night. He also made the stars. So God created the sun. Unfortunately, the sun today is affecting many people in this planet, and mostly because of the ozone layer that is not there. It looks like with the pollution, there is a filter that should be in the atmosphere, and this filter is disappearing. When this filter disappears, the rays, UVB and UVA rays, will penetrate more and will cause more burns. And with more burns, we will have more skin cancer. But one day, we will not have this anymore, because God is preparing another earth that will not have the effect of cancer that we have nowadays. Thank you very much, and I will see you in the next chapter of the Cancer Prevention Seminar. Thank you for your attention.